Good afternoon. Our lecture for this afternoon would be on health policy and health laws. So health policies, these are public policies or authoritative decisions that pertain to health or influence the pursuit of health. So this may be commonly known as laws or executive orders. So these health policies affect or influence groups or classes of individuals or organizations. So there is public versus private policy making. A public policy is a policy that is established by the federal, state, and local levels of government. For example, in the Philippines, this would be the Bayanihan Health Law, which affects public policy in response to the coronavirus pandemic. Private policies are policies that is established by private organizations. For example, Perpetual Health and JFSM as an institution may require you to have a physical exam for us to accept you as medical students to our institution. Laws. These are rules of conduct or action prescribed or formally recognized as binding or enforced by a controlling authority. This is enacted by any level of government, and this can also be referred to as a program. For example, the Medicare program or PhilHealth program, wherein all Filipinos are required to be members of PhilHealth. Another example of law would be the National Immunization Program, wherein all babies are required to get BCG, hepatitis, measles, mumps, rubella as forms of vaccination. Rules and regulations, this is designed to guide the implementation of laws, and this can be made in the executive branch by the organizations and agencies responsible for implementing laws. So this would be the one that would implement the laws that are made. So for example, regulations for the National Immunization Program would be it to be available in all health centers in the Philippines as to be given to the marginalized people of Philippines who cannot afford private medical care. Operational decisions are made by the executive branch of the government as a part of the implementation of a law. Normally, these decisions consist of protocols and procedures that follow the implementation of a new law. So these decisions tend to be less permanent than rules or regulations. So for example, in emergency cases, there are operational decisions. For example, the coronavirus, so there would be temporary decisions such as requiring face shields, then eventually going back on them, etc. This physical distancing, initially at 1 meter, then subsequently decreased. These are operational decisions. Judicial decisions are policies that are created as a result of a decision made in the court system. So for example, an opinion listed in 1992 by an administrative law judge stated that the hospital was in violation of the Rehabilitation Act amendments of 1974. So these would be coming through settlements or judgment decisions made in court. And macro policies. So these are broad and expansive and help shape a society's pursuit of health in fundamental ways. So for example, our Food and Drug Administration regulation of all pharmaceuticals and any substances. So there are different categories of public health policies. So your public health policies are grouped into two categories. It could be allocative and regulatory. So allocative policies, these are designed to provide net benefits to some distinct group of class of individuals or organizations at the expense of others in order to ensure that public objectives are met. In general, allocative policies come in the form of subsidies. So, for example, this is your Medicare and PhilHealth and federal aid. Regulatory policies, on the other hand, are designed to influence the actions, behaviors, and decisions of others to ensure that public objectives are met. So, five main categories of regulatory policies are social regulations, quality controls on the provision of health services, market entry decisions, rate or price setting controls on health service providers, and market preserving controls. Quality controls. So these regulations are intended to ensure that health services providers adhere to acceptable levels of quality in the services they provide and that producers of health-related products meet safety and efficacy standards. Examples would be FDA regulation of pharmaceuticals and new pay for performance regulations. Market entry restrictions. So these regulations focus on licensing of practitioners and organizations. For example, would be certificate of need programs and your physician credentialing or boards for physicians such as boards here or your MCI in India. Rate or price setting control. So these regulations are designed to control the growth of prices. For example, the federal government's controls the rates of reimbursement to hospitals that participate in the Medicare program. And market preserving control. So these regulations establish and enforce rules of conduct for market participants. Examples of which would be antitrust legislation. So these are the type of health policies that we usually encounter. So your assignment would be to look for health laws and policies in India and make an example for each one. So at the end of this lecture, you are expected to submit um, one law, one rule and regulation, one judicial decision, and so forth, and one example each of, for example, market preserving controls, etc., etc. Thank you for listening to this lecture. See you at 4 p.m. for a live discussion.